I want to make it crystal clear what this bill is about. This bill is about our first responders. This bill is about our heroes and their families. This bill is about the victims who lived at Ground Zero. This bill is about the children who are currently suffering from asthma, the most vulnerable in our communities who could not tolerate these toxins in their bodies. I'm going to tell you about 3 individuals whose story are particularly moving. At a time when most people were running away from Lower Manhattan, Joseph Picuro rushed to the World Trade Center site to volunteer his expertise as an iron worker for these rescue efforts. For 28 days, Joe helped cut steel beams on the pile to find survivors and to clear debris, often sleeping on the floor of a nearby office building rather than returning to his home and his family in New Jersey at night. In the years following his dedicated work at Ground Zero, Joe was diagnosed with sarcoidosis, a reactive airway dysfunction syndrome, and severe acid reflux. He suffered from constant joint pain, seizures, blackouts, and relied on dozens of different medications. Unable to work for years, Joe had to fight to get his workman's compensation for his illness. In October, Joe passed away at the age of 43. He left behind his wife and his daughter, Allison. Joe's wife, Laura, recently wrote me a note of plea. She said, "Our financial situation is bad. I mean bad. For 6 years, I've had to beg for help, borrow from family, and I just can't do it anymore, and I shouldn't have to. We need to reopen the Victims' Compensation Fund." This bill is also for people like Frank Ferrone of California. Frank was the division chief of the Menlo Park Fire Department in California, with thousands of miles away from New York City on 9/11, fighting wildfires. Along with thousands of other brave men and women who came from all across this country, Chief Ferrone traveled to New York to aid local rescue workers at Ground Zero. He had seen his fair share of destruction during his career, but nothing had prepared him for what he saw at Ground Zero. He worked 16-hour days with fellow rescue workers, inhaling that toxic dust that later left him with lower respiratory airway disease. Living across the country, far from New York City, Chief Ferrone still feels the effects of working at Ground Zero, which he says limited his ability to respond to other disasters like Hurricane Katrina. Chief Ferrone has had difficulty getting health care in California for his ailments and says that living out here in California, I cannot get confirmation or even a face-to-face with anyone affiliated with 9/11 health issues. I do not know if I'm going to be covered for my health concerns. What happens when this health issue disables me and I can no longer work or care for my family? Our bill would meet the needs of this division chief and this man and this hero who came to help when he was needed. The last story I'd like to give is that of Robert Helmke. Police officer Helmke died at the age of 43 from stage 4 metastatic colorectal cancer caused by inhaling and swallowing the toxins at Ground Zero. He was 43, I'm 43. Robert worked numerous hours of duty at the World Trade Center. He ate food and unknowingly inhaled the toxins while he was working. At no time while he was working at the site was he instructed ever to wear protective gear or any kind of breathing apparatus, nor was he told by our government that the air was in any way unhealthy or bad for him. Stage 4 metastatic colorectal cancer is a form of cancer that affects the upper GI tract, and it is very rare in someone so young. He was told that treatment would not cure him, that would only help him to live a little longer. I want to read to you his reaction to the diagnosis in his own words. He said, "Talk about crushing news. My wife and I sat in the car and cried as I asked her, what did I ever do to deserve this? On July 11, 2006, I had major surgery to remove 2 tumor parts from my small colon and have radiation on the large tumor in my liver. Before my surgery, I had 4 chemotherapy treatments and was in an emergency room 3 times to be treated for dehydration before finally having to go on an all-liquid diet and intravenous feeding. I have a wife, Greta, and 2 young children, Garrett and Amelia, who have seen my health worsen since participating in the World Trade Center recovery. My favorite things in life are slowly being taken away from me: my work, food, helping others, and caring for my family. Officer Helmke died on July 28, 2007. These are the stories that really tell us what this bill is about. Men and women who are suffering, men and women who have died, men and women who have suffered so much because they did the right thing. What message are we sending here from this body, this esteemed body, if we cannot help those who came to our rescue, who were there to find survivors, who were there then to find remains, and who were there to do the cleanup when our government asked them to help? You must remember the days after 9/11. This country would have done anything to help those who had suffered so much in New York and across this country. This was the most deadly terrorist attack in the history of America. And now, 9 years later, this body cannot come together to do what's right. This is the clearest example of right versus wrong that I have seen in this body in my 2 short years. We must recognize the undeniable obligation that we have, a moral obligation to protect these men and women and their families because they did the right thing. It is now time for this body to do the very same.